right. Well, welcome everybody. My name's Erica Nelson, and I am a co-president of the League of Women Voters of Glen Ellyn with Kristen Malone. My role tonight will be as the moderator, and I'm joined tonight by Mike Murray from the League of Women Voters, Roselle Bloomingdale, who will also act as a co-host. Milton Township will have an opportunity on April 6th, this coming Tuesday, to pass a referendum to start a community mental health board. And in DuPage County, only Bloomingdale Township has a 708 community mental health board, which was passed with the help of the LWV Roselle Bloomingdale. This program is the last of 4 programs on how mental health boards could work in Milton Township and our community, and is specifically related to the complex issue of addiction and substance use disorders. We're going to hear from 3 accomplished professionals this evening. Jordan Esser from the DuPage County Prevention and Leadership Team. Welcome, Jordan. Suzanne Snyder from Access Community Health Network. Welcome, Suzanne. And Mary Egan from Rosecrans. Hello, Mary. Welcome. We hope to gain an overview of the current state of affairs, learn how 708 boards work with Access and Rosecrans, and we hope in the future work with the Prevention Leadership Team of DuPage County, or PLT, as it is called. Again, if you have a question during the course of the presentation, you may ask it in the Q&A button at the bottom of your screen, and I'll do my best to answer as many questions as possible, bring them to our experts, either during their presentation or at the end of it, where we leave time for questions. Mike, do you have anything you want to add before we begin?
Yeah, thank you, Erica. Lots of people look at addiction and as a moral failing or a weakness. But I know we're going to learn tonight that this is not the case, and that there are things we can do at a community level, that will not only restore wholeness, but also lessen the impact both for the individual, the family, and the community. And there are success stories. Also, I'd like to mention we're still receiving questions about how 708 boards fit into community life and the mental health picture. I think we're going to get insights on that tonight. But you know what, Erica, we have lots to cover. So will you kindly introduce our first presenter?
Absolutely. Thanks, Mike. Our first presenter tonight is Jordan Esser. Jordan graduated from Western Michigan University in 2009 with a Bachelor of Science in Community Health and minors in Business and Holistic Health. Jordan began her career in community health with the DuPage County Health Department in 2010 as a health promotions specialist, developing and delivering free health education to schools throughout DuPage and speaking to students spanning from kindergarten to college and adults. In 2014, Jordan took a new role on at DuPage County Health Department in community initiatives and is currently the project coordinator of the DuPage County Prevention Leadership Team, PLT, a drug-free communities funded coalition. As project coordinator, Jordan runs a countywide coalition working to prevent substance use and increase mental wellness among DuPage County youth. Environmental and policy change are 2 main strategies the coalition is utilizing to affect substance use and abuse among youth in DuPage. And significantly, Jordan was born and raised in Glen Ellyn, so she has firsthand and deep knowledge of the issues and complexities confronting Milton Township. Jordan, welcome. I know that you have some slides you want to share with us, so I'll let you go ahead and do that.
Yes, let me pull that up. Okay. And I should be good.
We can
right?
see those perfectly.
Okay.
Yeah, they look great.
Well, first, I want to thank Erica and Mike for inviting me to be part of this panel tonight. I'm happy to share some information to help show the need for prevention and shine a light on substance use prevention and mental health. So as Erica said, I'm the project coordinator of the DuPage County Prevention Leadership Team through the DuPage County Health Department. And we do a lot of prevention work throughout the county. I think tonight I'm going to share some data with you on some of the data we've collected over the years. And our coalition uses a lot of different sources of data in order for us to make data-driven decisions. So we do a lot of surveys, we do focus groups, we look at juvenile arrest data, hospitalization data, but our main source of data is the Illinois Youth Survey. So you can see here on this slide just a brief overview and background of the Illinois Youth Survey, or IYS, because we love acronyms in public health. The IYS is a self-reported adolescent survey administered in all schools throughout Illinois. Schools, it's not mandatory, so our coalition puts a lot of effort in to encouraging schools to register and take the survey and see the value in the survey. And typically in DuPage County, we have over 50% of all public and private schools participate in the survey. It's free, it's completely 100% funded by the Illinois Department of Human Services, and it takes about one class period for students to fill out this survey. There's a lot of great information in the survey, and it's publicly available on a county-wide level. So the individual school surveys are kept private to that school, but anybody, you could just Google Illinois Youth Survey, DuPage, and you'll find the full report. And you'll see all of these data points. I have highlighted the data points that our coalition in particular takes a look at, which is drug prevalence and behavior, drug use contributing factors, and mental, social, and physical health. And those are some of the data points I'm going to share with you tonight. I do want to point out that we had many schools that fall into Milton Township feed into this 2020 report. So the data I'm going to share is the countywide data, but these schools in Milton Township and these students in Milton Township did contribute to the data. So we have data for 8th grade, 10th grade, and 12th grade. And I've also provided some trend data here. So I just went back as far as 2016. 2020 is our most recent report. So the question posed in these slides to these students were, have you used any of the following substances within the past 30 days? They also ask about drug use within the past year, but our coalition really looks at the 30-day use rate because we feel like if a student has said, I've used this in the past 30 days, they're probably more likely to be a consistent user versus they just tried something or they had an opportunity sometime within the past year. So we look at 30-day past use rates. So the gray bars here are the 2020 most recent data. The sample size for 8th grade in 2020 was 4,026 students. 9% of those students reported using alcohol in the past year, or I'm sorry, past 30 days. 2% reported using marijuana. 3% reported using e-cigarettes, and 1% reported using prescription drugs not prescribed to them. I want you to really look at the e-cigarette use rates because you'll notice that they've significantly declined among all grade levels between 2018 and 2020, and we'll talk about why that might be in just a bit. When we look at 10th grade, the sample size for 2020 was just over 3,000 students. 21% of 10th graders report using alcohol in the past 30 days, 9% report using marijuana, 11% reported using e-cigarettes, and 2% reported using prescription drugs not prescribed to them. And we look at 12th grade, the sample size was just over 2,000 students, 36% reporting alcohol use, 19% reporting marijuana, 18% reporting e-cigarettes, and 2% reporting prescription drugs not prescribed to them. I should also point out that this data was collected pre-COVID. So this countywide data report is still statistically representative of the county, but we had significantly less schools feed into this report this year. And that's because of the school shutdown. So just to keep the integrity of the survey, it had to be done within the school building and it couldn't be done online. So all of this data was pre-COVID. Our coalition is very interested in doing some other surveys to see how did COVID impact potential mental health and substance use issues. So summary and some takeaway points from the substance use data I just shared. The top 3 substances used among DuPage County youth as reported by DuPage County youth are alcohol, marijuana, and e-cigarettes in that order. Substance use has been declining among all grade levels in DuPage County since 2014, which is good news. You also probably noticed on those slides, the percentages might have seemed a little high, 36%, of seniors reporting using alcohol, but that means the majority of students are drug-free. So that's good news. E-cigarette use has dramatically declined between 2018 and 2020. And I think we can look to the huge investment in vaping prevention education that has been implemented nationwide. There was a lot, the vaping issue came up very quickly. Schools and teachers really struggled at first to know how to handle it because there were no lesson plans, there was no communication campaigns, and very quickly the prevention world jumped in and invested a lot of money, and we see the direct impact in just 2 years. So that's great news as well. And additionally, some very strong prevention policies have been adopted statewide and nationwide. So there's been a flavor ban implemented on the vaping devices. That was one of the main reasons teens were attracted to them, because they came in cotton candy and gummy bear. So those flavor bans have really done a lot of good as far as not appealing to youth as much. And then Tobacco 21, which was passed in the state of Illinois just a year or so ago, that increased the legal age to purchase tobacco products. So it allowed our high school age teens, they probably don't know many people that are 21. They might have known more people that were 18. So that kind of cuts it off at the source as well. We also look at mental health data. So we are a substance use prevention coalition, but you cannot look at one issue without addressing the other issue. And that's because researchers have found that about half of individuals who experience a mental health disorder during their life will also experience a co-occurring substance use issue, and vice versa. And that's from the National Institute of Mental Health. So our coalition looks at both of these issues, even though we're specifically funded for substance use prevention. So some more data from the Illinois Youth Survey pertaining to mental health. This is looking at experienced depression in the past 12 months. So the way the question is worded to the student is the definition of depression. So the student would read the question, it would say, have you felt so sad or hopeless every day for 2 weeks or more that you've stopped doing your normal activities? And that's the definition of depression. So we look at this data, 2020 is in orange. 28% of 8th graders surveyed said yes to that question. I have experienced depression in the past year. That is 1,110 individual 8th graders in DuPage County saying yes to that question. You look at 10th grade, it's 33% or 1,020 individual kids saying I've experienced depression in the past year. And 12th grade, 31% or 629 individual students saying yes to that question.
Jordan, can I interrupt for 1 minute? Thank you so much for including the N number, right? The number, because I think that really hits a nerve when you see that that number is associated with over 1,000 children. And you know that this is just a piece of that data, right? Because you've only presented this to X number of students who took it. So it's compelling.
Mm-hmm. Yes. I know the N helps because sometimes you're like, well, what's 31%? So when you look at it on an individual level, this slide talks about suicidal ideation. So have you seriously considered attempting suicide in the past year? Now, this question is not posed in the middle school level, so we do not have data for 8th graders, but it is asked at the high school level. So 16% or 440 individual students in 10th grade in DuPage County have said, yes, I have seriously considered attempting suicide in the past year. 13% or 243 individual seniors answered yes to that question. Now, oh, sorry, I forgot about this slide. I did also want to share, I represent the DuPage County Health Department as well. And we do have behavioral health services and substance use disorder services through the county. And I asked them to pull some reports for Milton Township specifically. So individuals in Milton Township currently receiving mental health services through the health department, and you can see the date range here within the past year, and those zip codes fall into this report. There's over 1,500 distinct clients that are under 18 years old in Milton Township receiving services through the county for mental health or substance use disorder. Total, there's over 7,500 clients at the DuPage County Health Department that live in Milton Township. So this, and like Mike said, this doesn't mean that these are bad people or they have a moral failing. I think that we've done a lot of great work nationally to reduce the stigma of mental health and substance use disorder. I think we still have a long way to go, but this shows that, one, there's a need, and two, people are more comfortable asking for help and seeking out services.
Right. Jordan, we had a question come in, and I just want to clarify that 12-month period is in 2020, correct?
For this,
From your statistics, the previous slide. So when we're saying the orange bar is 2020, what does that represent?
So yes, that's a good question. It depends. Schools can choose when they take this survey. So the student taking the survey, based on the day they took the survey, would be within the past 12 months for that student. So say the school registered and they surveyed their students in January, the student then would be answering the question in their head, okay, since last January, have I felt this way? But another school down the street could have registered in March. But the survey is done, in the same 8-month span of the school year, but students could be taking it at different times. Does that make sense or answer
Got
the
it.
question?
Yes, she just wanted to clarify, the person asking the question, that this was in 2020, whether it was in January or April or whenever it was. Got
yes.
it. Yeah, thank you.
It could have been late 2019. A lot of them happened in 2020. And then remember, very early in 2020, the schools were shut down. So
yeah, exactly.
This is all pre-COVID data. And the survey, the students either took it late 2019 or early 2020.
Great. Okay, thank you.
So to summarize the mental health data and some takeaway points, depression rates among DuPage County teens, again, pre-COVID, are double and then some compared to the national average. There's a national survey on drug use and health that was conducted. It's conducted every year. The most recent reports that I have access to is from 2019. They asked the same question, and 15.7% of adolescents nationwide report having experienced depression within the last year. Our rates are double that or more, looking at the grade level.
We have somebody who raised their hand, and if it's okay with you, we can't do this a lot just because of timing, but Claire, if I'm going to let you unmute and go ahead and ask your question.
That was a mistake. I'm sorry.
Oh, okay. No problem. Thank you. All right,
All
go
right.
ahead.
So what are we doing about all of this? So our coalition, like I said, we really look at all of this data to help us shape our action plan, make these data-driven decisions. And you can see here the top three, our three substances that we focus on for DuPage County are alcohol, marijuana, and vaping. Vaping is a method of use, so tobacco, even though you can also vape marijuana. So it kind of falls into the same umbrella. And then that mental health piece on the end is something that we look at, because like I said, you can't really address one topic without also addressing the other. So our coalition really aims to reduce those 30-day use rates. I already mentioned that those 30-day use rates have been declining since we were funded in 2014. We absolutely are not taking credit for that 100%, because lots of things go into that. There's lots of great prevention groups working, and we're working together, but we're happy to see that since we've been funded. We do a lot of policy work to help reduce these rates or reduce access to substances. Social hosting is one example of that policy work that we do. Social hosting is when an adult or a parent allows underage drinking or drug use to occur in the home. Through some of our focus group work, we know that this is an issue in DuPage County. I think it probably comes from a good place. That parent thinks that their child might be doing it anyway. Let me try to protect them, have it in my house. But we know all too often that ends badly. So the social host ordinance holds that parent or homeowner accountable. It's almost like a seatbelt ticket. If you've ever gotten a seatbelt ticket, you're wearing your seatbelt from then on because you don't want to pay the $100. We also invest in a lot of mass media communication campaigns, again, to address the stigma, increase knowledge around drug use. A lot of times we hear heroin a lot, and the county does a lot of work on heroin, and it is an issue. But when we're looking at youth, the data is really non-existent. They're asked that question on the Illinois Youth Survey, and so few kids answer yes to using it that it doesn't show up. So these are the things that they're using and then progressing on to perhaps later on. But we think of heroin as such a big deal, and so a parent or an adult might think marijuana legal comes from the ground, and so we do a lot of education around that. So, the developing brain and how substance use affects that and all of that. And then for mental health, we want to work with our partners at NAMI. Rosecrans, I know, is on the call. We have a Rosecrans representative on our coalition as well. And we want to do a lot of work around, again, addressing the stigma, coordinating crisis intervention, mental health first aid trainings for school staff and for caregivers and parents to know what those warning signs are.
Okay.
We also have a crisis text line. So we've used some of our grant money to help promote this. This is available to anybody in the county, but we really push it to the schools, to the teens. They're more likely to text somebody when they're having a problem versus talking to somebody in person or picking up the phone to call.
Right.
And this code word and number is unique to DuPage. So we're able to grab data to see what are kids texting about and how old are they and stuff like that. So if they text REACH to 741-741, they're connected to a trained professional to help them walk through a crisis. This is some data from the past year. We do have pre-COVID data in 2019 and post-COVID data in 2020. You can see the top 3 issues in 2019 were school, relationships, depression, and sadness that kids were texting about. In 2020, they're the same, except school was replaced with anxiety and stress, which makes a lot of sense because they weren't in school, but they probably had a lot of anxiety and stress. The number of individuals using the crisis text line also increased between 2019 and 2020. Those who identify as male increased in 2020. And the number of people who identified as heterosexual using the crisis text line also increased in 2020. So if we had additional, we could always use more money, right? If we had.
Right, and this is, Jordan, this is, just to interrupt for a minute, this is
Yeah.
perfect because we do have a question. What services would you like to provide if you had additional funding? So speak to this and then we'll move on to our next panelist. This is great.
Okay, great. So yes, we could do a lot more. We could establish more best practice prevention programs in the schools. We could establish social emotional learning programs like BOTFIN. NAMI has great programming, but it costs money. Lions Quest through the Lions Clubs is another best practice prevention curriculum. We could do more mass media campaigns. The drug companies have a lot of money to push their products. Prevention, not as much. So we're competing with a lot of those messages. So we could always use more support there. Funding local coalitions is always a great idea. Those are the boots on the ground, the people that are really making things happen, getting the work done. And then we can also fund surveys to help schools better understand the issues that their students are dealing with. IYS is great and it's free to schools, but this group Authentic Connections, which is a national organization, they cost money, but they do a more in-depth survey, and then they stick around and help the schools address the issues that might have come out in that survey. So those are all.
They do follow-up.
Yes. Mm-hmm.
Correct. Good.
Yeah.
Well, this is a perfect list because fingers crossed, we're supporting hopefully the 708 board to pass next Tuesday. And then we have in front of us that list of areas that could be, that are gaps that could be addressed, should that money become available for Milton Township. Yeah,
Yep.
Jordan, thank you so much. We'll have more questions, so you'll be coming back on when we're at the end of our presentations, but thank you. And thank you for the slide deck. It was just great and really helpful to see that. So our second speaker tonight is Suzanne Snyder. Suzanne is the Director of Behavioral Health at Access Community Health Network, where she's been employed for the last 20 years. Access is the Chicago area's largest provider of community health, having 35 health centers located throughout Chicago, Cook, and DuPage counties. It serves more than 180,000 patients each year as a federally qualified health center. Suzanne received degrees from the University of Chicago School of Social Service Administration, in addition to a Master's of Divinity from the Chicago Theological Seminary. Access has received grants each year from our neighboring Bloomingdale Township Mental Health Board, and Suzanne was and is pivotal in identifying the need and developing those grant requests. Suzanne, thank you so much. And if you could start out along with your presentation by talking about some of the programs you received grants for from the Bloomingdale Township Mental Health Board and how those grants allowed you to expand service in the community for maybe those who are familiar with what a federally qualified clinic actually does. Thank you.
Thank you so much for inviting me tonight. It's truly a pleasure to come, and it's truly a pleasure to share some of the great things that we've been able to provide for community members and patients at our Martin T. Russo Health Center in Bloomingdale. I will start by talking about what a federally qualified healthcare center is, and then a little bit about the 3 projects that we were able to get seed money for through the Bloomingdale Township Mental Health Board, and how those are progressing. And then I don't really have a formal presentation as much as I just want to add some words around some of the things that Jordan said around how does integrating mental health and substance abuse care and prevention into overall health and welfare in a community, and from my perspective in primary care, makes an overall health difference for a community, and again, from a primary care perspective. So a federally qualified healthcare center, and apologies for those who know that term, some do not. It means that we are a group of primary healthcare providers that have funding support through the federal government, HRSA, in order to provide primary care to underserved communities. So that means we can serve folks through sliding fees that are uninsured, underinsured, Medicaid, MCOs, as well as private insurances. And that another thing that's very important about FQHCs is that there is very much an expectation for excellence and best practice. And one of those best practice expectations that has kept me at Access for 20 years is the expectation that we integrate at all levels, preventions through treatment to referral to partners, substance use and mental health as an integral part of primary care. And so for us, working in partnership with Bloomingdale Township Mental Health Board and the other grantees, I want to share briefly 3 pilots, again, that we had seeded through those funds. The very first year, we were granted funds to seed what we call it medicated assisted recovery. Other folks may call that a medicated assisted treatment program for opioid use disorder in our primary care setting. And that has just been a fabulous blessing to Bloomingdale Township residents, community members, family members, and our patients. And to tag a little about what Jordan said, I would say the average patient that we work with in our MAR program is over the age of 45, and many in the category that I'm in, which is senior citizens, or whatever you want to call us. And just to share one very moving thing that happened within the first month of opening, and I'll be talking a little bit about this perhaps during stigma, but we practice something also called SBIRT, which means, and again, as Jordan said, we love our acronyms in healthcare. But SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. So screening, briefly intervening if there's a concern, or referring to treatment as needed. And so we practice that as a prevention measure at all of our health centers around substance use. And that is not the behavioral health folks necessarily that are doing that, but that would be the primary care providers and team. And so through a screening of a woman regarding substance use, which includes medication and prescriptions, and not cherry picking who we asked that, but doing that universally, the issue came up of off what she had prescribed in the past, but how she was getting opiates to care for herself, because she had found herself to be in a situation of addiction. And she had told no one, not her husband, not her children, and she just did not know how to get help. And she was considering, as Jordan also mentioned, that perhaps the best way out was to just end her life. And part of the biggest concern for her was the stigma she felt for herself. And she embraced fully getting care right there in our health center, was able to begin her process of recovery, continues in that. It's now been almost 3 years, and able to talk even openly with her family and children and spouse about that. So I think that speaks to the importance of destigmatizing how we look at different health concerns, and how important that we meet people where they are in communities, and we normalize asking questions about that, and then having those services ready at whatever level is needed.
Suzanne, can I interrupt really quickly? Because there's a question that
Yes.
ties into this, and it also speaks to just some statistics that we've heard of in the last webinar, and that is that the first 6 months of 2020, and Jordan talked about this a little bit too, saw a 23% increase in suicide and a 52% increase in fatal drug overdoses in DuPage County over 2019. And the question from one of our participants is, do you have a hypothesis why our DuPage rates of depression are double the national average, what Jordan shared with us? Do you have any thought on that?
So I want to be cautious in my hypothesizing, because, and I've shared this often with Mike and the Bloomingdale board, and this is one of the reasons we're just so grateful for this, because we have a president DuPage for a long time, but we actually come from being very much more in the urban setting. And so I don't want to say like, oh, I kind of know, as if like, but I do think that anytime we see rises in those, it usually means that there's some added stressors that perhaps folks are not feeling comfortable reaching out for help, or there's unidentified stressors that may be happening. And that can happen in a number of ways, where we make assumptions either quote unquote to the positive or to the negative, and so people don't respond. And so to take that out of the substance use area, I was talking about normalizing around stigmatizing. If we normalize questions about substance use, mental health, and what we call social determinants of health, transportation, housing, food security, then it becomes more comfortable for me as a person to share with my provider about that. So an example that we have at Access, every patient, every visit, if it's children, we're asking the parents, every patient, every visit, we ask, are you food secure today? Because we do not make an assumption because I'm food secure today that I possibly may not be food secure in 2 months. And we know that from our neighbors and friends, our children. I have 3 adult children, they all lost their jobs this year, so, and I know that I'm not, unique in that. So different struggles. So I would say that depression. And the other thing I would say about youth, but I would want to turn this over also to Jordan more, I would caution that we don't underestimate the importance of understanding stress and anxiety, and that oftentimes anxiety is just as dangerous when we talk about suicide as is depression. And goodness knows that all of us have been under greater stressors and anxiety this year. So we really think as communities, we must be looking at that level of anxiety, and again, making it safe to talk about that. So I hope that answered the question.
Yes, it does. Thank you so much. And then why don't we spend another, say, 3 minutes on your comments. We'll move to Mary, and then we can come back and answer some more questions and get a little bit deeper into some of these issues. So go ahead, Suzanne.
So I just want to give a chance, because I'm sure as the voters in your community would like to hear, well, what are some of the ways that funds through this other example mental health board have been utilized. I think it's important to hear that and to understand that from our perspective at Access, we see going to the mental health board at Bloomingdale to help us seed something that we then understand we need to be able to sustain and continue. That is not something we try for a year and stop, but rather you can help us launch us, because so many times when you're starting something new, it's that startup cost that's tough. So the second year, I wanted to share that we were able to launch telepsychiatry, which psychiatrists are very tough to come by. And so being able to link Bloomingdale Township and Russo Health Center to psychiatrists in our system that are in the city or in the closer college suburbs was really helpful. And then this year, we are starting a pilot where we work primary care and behavioral health together with our patients who are either newly diagnosed or having difficulty managing their diabetes through behavioral health coaching and screening again. So again, that screening and not assuming that we know what is their distress level around managing diabetes and opening that up. And so I just share those as three grants that we are grateful for our patients at Martin T. Russo to have. And I think the other added advantage, you were asking, what did I think perhaps in DuPage? And I'm cautious with that because I love all of our health centers, and I definitely come out to Russo a lot around our HIV programs and other programs, but I've never actually practiced in DuPage, and my career has always been practicing as I'm a licensed clinical social worker in the city. But I would say that the best thing for me in being able to understand better what are the needs of the community around our health centers in DuPage has been the networking and the connection that has happened and is building every year more and more through the fellow grantees of those that receive those every year, whether it's been connecting with police departments, school social workers, people working in early childhood. You know, this year we're able to go to a biweekly networking meeting around the needs, developmental needs and issues around children, both prevention and treatment. And I would never have had access to that. And it's interesting because when I went to the last meeting, they're like, we're so glad you're here because you're the one primary care person. And I'm thinking, well, I'm so glad I'm here because I understand more now. So I want to just share that point. And I would close with the last thing I just kind of want to say about stigma is anytime we're putting something aside as separate, then the likelihood of perhaps not getting help as soon as we can increases. Mm-hmm. And so maybe some of us may feel uncomfortable about opiate use disorder or someone vaping or mental health. But I would just remind you, because I'm more of a senior person here tonight, I remember as a child, sometimes among my parents' friend groups, they would be chatting, right? And then they would talk about one of their friends. And then I'm just, I'm a social worker. So I was even at that point, like big ears, and that the voice would lower. And they were talking about a disorder that wasn't okay to talk about. Does anybody want to guess what that was? Cancer. It was cancer.
Yeah.
And so I had the weirdest, just most unhealthy kinds of thoughts about cancer growing up, even into my adulthood, and just watching that change in terms of, we think about the walks for different kinds of cancers, and that's not that long ago. So whether it's cancer, whether it's Hep C, whether it's HIV, whether it's mental health, whether it's substance use, anytime we don't embrace our overall health and understand that all of those, so co-occurring disorders, as Jordan said, are both mental health and substance use. It's also all of our other disorders and problems that can happen just from the stress of hiding some of those things. So I would just want to put that perspective from my life into how important as communities and the toll it takes on our social network when we aren't doing prevention and addressing them and getting the care and partnering. And I think that allows me to turn it over to Mary, because she, her introduction, because she would be an example of an organization that, as a primary care provider, that we very much lean to when we needing to refer to another level of care and specialty.
Suzanne, thank you so much. I'm enthralled with all of your presentations so far, and Mary now coming up. And I guess the takeaway that I want to reinforce for the community listening in and for you to share with your friends, neighbors, family members is to hit hard on the comment that Suzanne made about that network and that partnership. And it's due to the fact that this grant comes from the 708 Community Mental Health Board in Bloomingdale. And then you're able to connect those dots, as it were, to really be sharing that information and reinforcing what those needs are and how to bring your expertise together to help. And that's the power of community mental health and doing it together. So thank you. Thank you so much. Mary, welcome. Bring us home here, and then we'll have a couple of questions. Mary Egan is the Director of Outreach at Rosecrans. Founded in 1916, Rosecrans is a leading provider of behavioral health services with nationally recognized addiction treatment programs. Rosecrans serves clients at locations across Illinois, Wisconsin, and Iowa. Mary has worked at Rosecrans since 2008, has an undergraduate degree from Quincy University in addiction studies and psychology, and a master's in counseling from the University of Illinois in Springfield. And so, Mary, what I want to do is turn this over to you. You have some slides to share with us, and also want you to think about your work with other 708 mental health boards in Northern Illinois, and giving us an idea of what those collaborations mean, both for communities and for Rosecrans. So I'll turn it to you.
Yes, thank you. Thank you, Erica. And thank you to those that are here watching this webinar live and those that will watch this recording. I'm happy to be here to talk about coordination of care for those with addiction or substance use disorders and mental health. I am a certified alcohol and drug counselor, have been in this field over 35 years, and the advantage of being in the field a long time, I've worked in prevention, I've worked in treatment, and so I've seen a lot of trends come and go. And you know, it's encouraging to me to see the state of the field now as we continue to progress. And Rosecrans has been around 100 years and been providing services in over 60 locations, and you know, in Illinois and Iowa and Wisconsin. So it's great to be able to talk about how we can support those in our communities who might be experiencing mental health or substance use issues. So Rosecrans collaborates with a couple 708 mental health boards in McHenry County and Winnebago County. And I'm going to tell you a little bit about what we do and the advantages of those collaborations. So some of the advantages of this collaboration is the mental health boards provide leadership in prevention and treatment. And so one of the things that, you know, in that leadership is just networking with agencies and identifying trends in the community, providing that leadership. What do we need to do with prevention, as Jordan talked about, with vaping and marijuana education and those kinds of things? Where are the service gaps with treatment resources? You know, sometimes new trends develop and we realize maybe that there's not detox from opioids or medication assisted therapies. And so maybe there's not services for teens or older adults and those kinds of things. And so the mental health boards really do provide leadership in identifying those trends, and then also working with the resources in the community to say, okay, Rosecrans, you know, where you're identifying this trend, can you help provide services for these members in the community? Another thing that the mental health boards can do is really strengthen recovery efforts in the community. Both Winnebago County and McHenry County have strong recovery communities. And we know that when someone is in recovery from a substance use or mental health disorder, that their lives are functioning. They're living their life in a way that's more productive. And so the mental health boards provide funding for treatment services and also recovery homes, improving that access to care, because we do know that mental health and substance use disorders, it's hard to figure out, where do I start? I'm noticing changes in my child with their mood or their substance use, and who do I reach out to? Who do I talk to? Maybe in my senior mother, you know, is maybe drinking more. Who do I talk to about that, and where do I start? And so it's improving access to care. And maybe for those, as I think one of the previous speakers talked about, maybe that are clients who are underinsured or have Medicaid or no insurance. And so it's providing that access to care, so to restore that person to a healthy balance in their life. Another part of that is increasing awareness of existing services. Again, the mental health and substance use field it's hard to navigate in some ways. As the field has developed, previously we had sort of these silos of mental health and substance use. And as the field has developed, we now realize that clients have to be treated with both disorders at the same time because it is coexisting. And so we have to improve that access to care because our clients do have both disorders usually at the same time. Increasing awareness of the services, leadership and advocacy for these issues in the community, and to strengthen provider collaborations. As working for treatment organizations, we do collaborate with other organizations, but are we collaborating on where the needs are? Maybe Rosecrance identifies a need and, the local hospital system is seeing something else. And so we need to talk about that with each other so that we can continue to provide services for the residents in the community. So funding has come from the Mental Health Board to support some of these services. So I think Suzanne talked about psychiatry. It's really difficult in many communities to access psychiatric care, for teenagers or children, for people with Medicaid funding, for example, or any kind of psychiatry. So the mental health boards have funded that service. In McHenry County, the Mental Health Board provides student assistance services in the school so that the counselors are working at the school, they're providing assessments, they're collaborating with the school and the parents, and they're providing prevention education in the school. And if the student needs further mental health or substance use services, they're able to help and support and navigate to get that student to the next step. There's also funding for those without insurance for substance abuse or mental health services, funding for the recovery home. One of the things that we know that when someone needs treatment for services, we know that the longer they're in care, the better their opportunity is for recovery. And so for some, their bonds with their family have been destroyed. And so they really need to live in a sober environment for a period of time to really extend their treatment and their recovery. Some of the other neat things that have happened in McHenry County, there's a mobile crisis response and crisis line. So Rosecrance manages this so that if somebody's in a mental health crisis, for example, they can call the crisis line. Counselors go out to the home to evaluate and assess and connect the clients with services. One of the more recent kind of really neat things that Rosecrance is proud of in the Winnebago County is that we are part of the community crisis response team. So you might have heard about this on the news, where a mental health clinician attends 911 calls with police. So, if there's a situation involving mental health or substance use. So for those that are chronically mentally ill or there's substance issues, and police aren't always have received the extensive training that mental health counselors can help and support and connect those people to services, so that it doesn't escalate, that it doesn't, just create additional problems for those people that are really experiencing some health issues that really just need services. So I think it was Mike who talked about, addiction is not a moral failing. A substance use disorder is a disease of the brain that is evidenced by behavioral issues. And so, some of the risk factors, if you have that gene, you might be more susceptible to developing some of these disorders. Jordan talked about co-occurring issues, that people with mental health often have substance use disorders and vice versa. And so we really need to be aware in our communities that we need to treat these together and depending on what sort of primary at the issue, but we need to treat them together. Otherwise, it just prevents someone from, entering into recovery. When a teenager uses when they're younger, because of their brain vulnerability, it increases their risk for addiction and trauma. It's one of the things McHenry County is doing right now. They're doing a lot of trauma education. And so we know one of the things that when somebody experiences trauma, it increases the likelihood of addiction. So people might use substances to, minimize those memories of traumatic experiences and, dealing with the kind of the brain changes that happen as a result of ongoing trauma. So people often say, well, why can't they just stop? You know, um, you know, I told you it's a problem. You should just be able to stop. And so it's this brain disease. And people use substances to feel normal, and it becomes not a choice anymore. It becomes this compulsion to use. And, it's at a certain point, people can't really envision their life without the substance because that's the item or thing that makes them feel better. And so the other part of that is if I admit that I have a problem, then I have to do something about that. And it just is so big and so overwhelming. Like, how do I even stop? And so sometimes people will promise to stop and, they can't because they don't have the tools to be able to stop. And that's where treatment comes in. And so one of the things about addiction is that it really does impact the entire family. And I should have put here that it impacts the entire community, because when someone is in an active addiction, their lives are not stable. So, in their job, they're not functioning. In their family, the bonds of the family and families can be broken up as a result of addiction. It impacts a person's health. When somebody's in active addiction, they could be, resorting to crime and illegal activities. And, it strains the hospital system. And I could go on and on about how addiction really impacts, not just the person, but all the people around them and the systems around them. And, and it's so hard for people to start with, where do you get help? And I like this. Our doctor talks about stigma in a way that when we talk about diabetics, we don't say they're a carb and sugar addict. And that's sort of demeaning and puts someone down and says that they should be able to, just stop. We don't talk about addiction that way. We talk about, that they're addicts, they're not clean, and all of those things. And so we really have to work towards, removing some of that guilt and shame, informing members of the community and individuals about treatment is available, treatment works. One of the things that I like to end with is the Rosecrans tagline is life's waiting. And when somebody enters into long-term recovery, they return to their normal life and healthy life activities. There are over 23.5 million people in the United States that are in long-term recovery and are active, productive members of communities and families. And when someone's in addiction or a mental health crisis, they're not
Right.
functioning in their normal life. So
That is a daunting number, Mary, when you said that out loud, and it ties into a couple of questions that have come up while you've been speaking, actually. So if you can stop sharing your screen so we can see everybody's face a little bit more, I want to get to those because it's an overwhelming, everything you're saying, and I think all of us are going to leave here tonight thinking, so what do we do about it? And there's a question that came up about the referendum question, which I'm going to get to in a moment. But the one that just came in a moment ago reads, DuPage County provides funding for a variety of social services through the health department and also through funding of other social service agencies in DuPage. How is this different? How is a 708 Community Mental Health Board different? And I'm going to ask Mike to unmute his audio for a moment because he has so much experience with the Bloomingdale Board. But I want to read something to you that I think speaks to this from Jerry Kurger, who's the executive director of NAMI DuPage, of whom all of you are quite familiar with. And she shared this with me. Much of the information about the referendum that is potentially opposing it is incorrect and might have you believe that you can just drive over to the health department or call a psychiatrist and be seen immediately. And you're all nodding your heads and saying that is not accurate, correct? And it says she says the reality is that the mental health services of the health department are primarily for people on Medicaid or Medicare. And if you have private insurance, you are not covered, you're on your own. Think of the gap of people within Milton Township and within DuPage County who have neither. They don't have employee-sponsored health care. They're not on Medicare or Medicaid, and may not be able to pay the sliding fee scale even that is provided through some of the other agencies around the community. So I'm setting that up as the setup to turn to Mike so he can speak to this a little bit. So how is this different, Mike?
Well, of course, the 708 Mental Health Act goes back to the 1970s, and it grows out of the Community Mental Health Act, which I believe was passed in 1963. Prior to that, people with addiction frequently wound up on Skid Row and places like that. Or if they had acted out profoundly, they would wind up in large state hospitals. And in 1963, that goal changed and those hospitals were closed. I think partly that was because of the availability of new medications and new treatment modalities. And the goal then was to bring those people so that they could live normal lives in the community, so that they could once again participate as I think, Mary, you mentioned life is waiting, and as Suzanne talks about creating that full life, and Jory, of course, mentioned about preventing it. That's the ultimate goal of course, the DuPage Health Department, to prevent those treatments. So that's how Community Mental Health Board, especially, like, one thing that's important to remember is that our Milton Township and the townships in DuPage, they're larger than most of the counties throughout the state. You know, Winnebago, I'm guessing Winnebago is probably about 150,000 people. I think McHenry is probably about 225,000 people. So if you take Milton, wow, that is a large county in the state of Illinois. And it is always daunting to relate to larger institutions. I know I went in to get my senior exemption for insurance, and I'm not too good with paperwork. My wife, I'll be quite frank, she prepared all the stuff, and I started mumbling, and the person grabbed it out of my hand and said, "I'll take care of all this. You just stand back." And that's the goal of the Community and Mental Health Board, for the community to wrap its arms around every member and lift every member up so they can reach their full potential. That's what this is about.
Right. And it is that challenge to provide these services in a consistent way. So I'm going to speak to this question about the referendum, and then we have one more question for all three of you to respond to, and then we'll close up. The question is, the language of the proposed Milton Township referendum references, quote, establish it and maintain community mental health facilities and services. And what the author is saying, what I'm getting from the discussion, is that a 708 board would be established in Milton Township if the referendum is approved. Yes, that is correct. And then she asks, and what about facilities? So that's a statute question, right, Mike? So speak to that.
Yeah. You remember this, we are fortunate in DuPage and in the metropolitan area to have access to a lot of services and to have places where those services can be rendered. But if we were in rural Illinois, those facilities might not exist. So the law is very broad, and no two 708 boards are the same. Every 708 board is truly unique, as every community is unique. So there is no necessity to build a facility or spend your money in that way. But in some areas, that might be the most important need, you know?
Right. So let me finish with one question, and it's to everybody, and you can give us kind of about a minute answer. Jordan, I'm going to start with you because you did have that one slide that talked about, so what might we do should a 708 Community Mental Health Board exist, be founded here in Milton Township, and know that those dollars are accessible. What's something that's really important right now in terms of programming? You spoke a lot about youth. It is heartbreaking to see those numbers and for us to know that that challenge is out there for them. What's something that you would like to see done if you had resources?
Sure. I think we're in a unique period of time coming out of this pandemic. We know that there's probably going to be some impact on everybody, but especially youth, and that's who I primarily work with. So I think we could use some of that funding to work with a paid evaluator, do some more surveys. That Illinois Youth Survey I showed is only available every other year. We don't get another opportunity until 2022 to survey our students. So it would be great to be able to hear from these kids now, and then, act on some of the things that they're feeling, experiencing, and that can help, again, kind of tell us how to spend the money instead of us just assuming, oh, we should have this program. We need to hear from the kids, how can we support you? And then take that information back. So paid evaluator would be great to help us conduct those types of surveys and focus groups and analyze the data. And then based on the results, whatever that support system looks like. I'd also like to see more of an investment in broadening the languages that some of our services and tools are available in. So our crisis text line right now, which we had 82 texters in 2019 before COVID. We had over 300 in 2020. We could definitely increase the people that use that line by broadening the awareness of that, but also we only have it available in English. So if you only speak Spanish or any other language, and we know we have a lot of languages in DuPage County, that tool isn't useful for you. Again, that would cost money. So I think those are two big things that I'd like to see happen, and I'd love to be a part of.
Yes, thank you, Jordan. And thanks for all that you're doing for our kids. Thank you.
Well, I'm happy to do it. Thank you.
Yeah. Mary, let's go to you. What's one thing, as you think about a community mental health board and some of what's already been available to you, that you would like to see added or continue?
I think the first thing that comes to my mind is just access to care. Rosecrans is a big organization, so we do lots of different things. So it's just working with the community to meet the gaps and to fill in the gaps of services and connecting people to services. Because like I said, when people enter into long-term recovery, they return to functioning in their community, and then you have a stronger community.
Yeah, thank you. And it ties into your whole conversation, and Suzanne spoke to this too, about de-escalating around the stigma. This is such a much more common conversation. We have to, as my mom used to say, get out of your own way on that, right? So yeah, thank you for that. And thanks for all that you do, Mary, and for being here tonight. Suzanne, what about for you?
I just think one of the things that a mental health board can do is also have some standards that they want to make happen across all the folks that are working with it. So two things that kind of stick out with me is one is that I'm hearing a lot around needs for children and youth. So I would echo what Jordan said. But the other thing is, as we come out of this pandemic, just the overall trauma that folks have endured, whether it's acute trauma and loss or just ongoing. And so I think a mental health board can really raise some standards of what is going to happen around agencies that are interfacing and networking together with that, around making sure that there is trauma-informed care for that, which is so important for our youth. And then I would include your safety departments in that. It has been so awesome for me to connect more with the police chiefs and safety directors in DuPage, that I never would have had that opportunity, and really not duplicating services and helping one another. And so I think that's another real avenue that makes me think about how you better interact for our youth and also be trauma informed in how you approach that access to care.
Right. Thank you so much, Suzanne. Last night on Tuesdays with Tara, which is Illinois Representative 48th District, Tara Costa Howard, the comment was made about the importance of recognizing the distress on our first responders. And to your point, Suzanne, how important it is that we provide that support within our law enforcement. So should a mental health board be founded in DuPage County, one grant might be for social workers that I know in Bloomingdale Township have been provided in the police departments. And that's not only for going out on those appropriate calls, but even within that department, that those law enforcement officers might have access to that individual. So there's so much overlap and so much important work that we could do by having these resources available. So thank you for being here tonight as well. I had a quick question come in on where you can find the recording. It will be posted on our Facebook page, Mental Health Boards for DuPage. And you can just look that up in your browser. It will also be on our league website, which is lwvge.org. And that will be posted as soon as that comes to me, which should be within the next 15-20 minutes, and I'll make sure we get that up right away. And then we'll just share that out everywhere. So we welcome all of you to take this and move it onto your social media and make sure that people see it. Mike, any last words before we close?
I just want to thank, I'm always once again inspired and learning. That's a great thing. And other alternative that the mental health board, it's a continuing education for the community. I know we've had a lot of lively meetings. I think Suzanne would testify, and all the talk of the grants is out in the open. I think a lot of times grants happen in Washington, D.C. or Springfield, or these discussions happen in the community, so you can hear and be a part of them.
Right.
Thank
And
you.
that's the beauty of, again, that local resource in your local community. So I can't thank you enough. Thank you so much for being here with me, Mike, and doing this. We have 4 recordings. They're all posted. We'll make sure we get those sent out again, including this one. And so grateful to all of you who could attend tonight. Please spread the word. Let them know to come and listen to this hour and 5 minutes, and it will change their understanding and hopefully their lives. So thank you so much, everyone. Have a wonderful evening. And thank you. We'll be in touch.